My practice have changed over the years from a general practice doing a little bit of infertility to basically only doing infertility. We would be seeing infertility patients and we would do treatment related to that. We also do some surgery related to reproductive medicine. So last year we did just over 1,000 fresh cycles. It will be 2 years that Dr. Forsking have joined me. We have 3 nursing staff, about 5 admin staff, and 4 embryologists full-time. We used to be 100% a paper clinic. Biggest challenge with paper was that anybody at any point, if you got a computer which has got access to MedITEX, you could access the patient's file. If you had a patient that had a number of treatments done, it was always a big issue paging through the file, hundreds of papers, files, patient files, all the records of the lab was done on paper. So basically we went from paper to basically MedITEX. I have came across colleagues that used different programs which did not give them a proper solution, and in some cases it was almost a little bit of a disaster. So I was very wary of just choosing anything. The fear was to have something that did not work well. I think first things first, it has been proven to work. There's numerous clinics and you've been going already for a number of years. I think there's numerous things, but I think one of the biggest things is communication in the clinic, because it's not like a normal medical practice where basically the doctor works by himself. The nurse coordinator or the embryologist have access to the data. So the communication between the different players in an IVF clinic is absolutely much better, and it makes things a lot more effective. The other one I think I mentioned is obviously cryo data. So that gives us proper data, but also from a financial point of view, we now can have more accurate billing. Cryo billing system was absolutely rubbish or almost non-existent. The other concrete improvement is just to get to the nuts. Not that I need to sort of struggle through a file and trying to make out what he was thinking. For me, in terms of the clinical part, as I say is accessibility of the notes. You know, each cog in the wheel has got their own part of MedITEX which they use, and I think that all in all, it has changed everybody's lives for the better. Every part of MedITEX affects different people, and I think that all in all, my impression is that everybody that uses it now experience it as being better than before. We definitely recommend it, and the first thing is that going for 2 years now, it works. We had support from you guys and ongoing support, so I think that is the second part. I think you're big enough that you're not going to go away one day, and all the features that we spoke about, and all the things, you know, as I say, access to data, communication, cryo program, all of those things obviously is things that will improve your the outcome. All of us would tell you is that it is a pity that we did not use MedITEX earlier. Having done my research, is that I think it's quite simple. It's that I don't know of anything better, and so I could definitely use it again. For me, probably the biggest satisfaction that I had, everybody in the team embraced it. We've got one of the nurses was really scared to use it. She's now probably the best user of it. to get to the point where everybody embraced it and now they say that this thing is working and it's better than before. So that probably for me would be the moment, okay, this thing is working. So that gives me an advantage. I would tell them is that you need to be committed to implement it, otherwise it's going to fail. Somebody asked me, is it a good program? I would say yes. To me, it seemed to be the best program. I can tell them that it works for me. Thank you very much. Keep well. Bye-bye.